Welcome everyone, and thank you for joining the Spina Bifida Association of Northeastern New York's first webinar in our virtual series for Spina Bifida Awareness Month. If you don't know, my name is Julia and I'm the Executive Director of the Spina Bifida Association of Northeastern New York. And I'm really excited to kick off our virtual webinar series with our Urological Updates webinar for a few reasons. We did have to cancel our conference this year, and we were really disappointed, and we know from our feedback surveys that individuals and families were missing that event too. So we wanted to bring it to a device near you. And also just the impact of the pandemic on people's lifestyle, recognizing that people are more isolated, they have decreased supports, and non-emergent medical appointments have been canceled. So this awareness month, we really wanted to focus on healthcare and helping you be the best you. So I hope you check out some of our other webinars taking place this month. And if you want more information, my email will be in the chat. For tonight's webinar, like I mentioned, it's recorded. And I will be monitoring the chat box for your questions, comments, concerns, whatever you want to share throughout the night. We will have a live Q&A at the end of the presentation, but please feel free to shoot your questions whenever they come up. And if it's time relevant, we'll just do a short pause, ask a few questions, and go back to the material. And if you want to submit your questions anonymously, you absolutely can in the chat feature. You can choose to send the message to everyone or just to myself, and then I will ask the question out loud anonymously, or you can also use my email that I will be putting into the chat. And then by next week, we should have a copy of the recording and the materials emailed out to you, and next week will be the latest. All right, so now I'm going to introduce tonight's presenter, Dr. Rafis. She's a pediatric urologist at Albany Medical Center. She completed her medical school and residency at Albany Medical Center, and then recently completed a pediatric urology fellowship at Nationwide Children's Hospital in Columbus, Ohio. At Nationwide Children's Hospital, she had extensive experience taking care of patients with spina bifida and performing reconstructive surgeries to help with bladder and bowel continence. So welcome, Dr. Rafis, and thank you so much for being here this evening. I will pass the mic to you.
Thank you so much for having me, Julia. I really appreciate the opportunity to get to talk to everybody tonight. So like Julia said, please, if any questions come up along the way, don't hesitate to ask. And Julia, feel free to interrupt me as we go along. Tonight's going to be a little bit of an update about what's going on here at Albany Medical Center with our new spina bifida clinic, and then giving a brief overview of all the things that we're doing from a urology standpoint to help you live your best life, as Julia was mentioning, and to make sure that your kidneys and your bladder are staying healthy. So to get started, let me make sure this works. There we go. So on the agenda for tonight, first I'll just go over who our pediatric urology team is here at Albany Med, some familiar faces I'm sure many of you will recognize. We'll also talk about the Albany Med Spina Bifida Clinic, and then we'll go over urology testing for spina bifida patients, and then more specifics about bladder and bowel management, and then we'll have lots of time for questions. So here's our pediatric urology team at Albany Med, and you probably recognize some faces, particularly Dr. Kogan, who's been here for a long time, and he's taken care of lots of patients here with spina bifida. And he was actually my mentor as I went through medical school and residency. He taught me most of the things that I know today. And then Carla has also been here. She's our nurse practitioner. She's been working alongside of Dr. Kogan for quite some time as well. And she helps with taking care of patients with spina bifida, young and older patients. And then Dr. Howe has been here for a couple of years, and he's also part of our team and takes care of some of you guys and our other spina bifida patients. So we all work together as a team. I will be the person who's in the spina bifida clinic, who you will see primarily if you come to that clinic, but you may see any of the other providers as well. So you may or may not be aware that Albany Med started up a specific spina bifida clinic in the last year or so. Currently, we're seeing pediatric patients, so that's aged newborn up to 21 years old, and we hold the clinic right now once a month. Currently, it's on the second Friday of the month in the mornings, so from about 8 in the morning until around noon. The clinic address is listed here, and most importantly is the phone number. So feel free to write this down. You'll also get a copy of the slides, and then I'll also have it again at the end for you. But this clinic is available to any patients with spina bifida, and starting in November, we're going to expand the clinic to include adult patients as well. So adults, we will be seeing on the second Friday of the month in the afternoons. So from around 1 to about 4 o'clock in the afternoon. There will be a different address for that specific clinic, but when you call to make the appointment, we'll give you that information at that time. So we're really excited about this clinic being up and running. It's been a great success so far. And if you haven't had a chance to make an appointment or come through the clinic, I strongly encourage you to do so. Some of the reasons why it's so important is all the different providers that you can see here in our spina bifida clinic. So our clinic coordinator is Jen Meyerhoff. So she helps get your appointment set up, helps to coordinate all the doctors that you will be seeing that day in clinic and any testing that you might need. But we have lots of different providers. So not only will you see urology in the spina bifida clinic, you'll also see neurosurgery. So Dr. Adamo, or you'll see Lisa, his PA. We also have orthopedics, physical medicine and rehabilitation, or PMR, and gastroenterology. So it's a great opportunity to see all 5 specialists in one office visit. It's also really important from the doctor's standpoint because this gives us an opportunity to talk to each other face-to-face about your care because we have a lot of overlap with each other. For example, if the neurosurgery team is worried about a tethered cord, they may ask our urology team to do urodynamics to assess further or to ask specific questions related to possible urinary symptoms related to tethered cord. On the other hand, we work really closely with gastroenterology or GI because the bowel and the bladder work very closely together. And so we're always asking you not only about how you're emptying your bladder, but also how you're emptying your bowels, because that can affect the health of your bladder and kidneys. So we work very closely with them as well. So just some examples of how coming to the clinic is not only beneficial for you so that you don't have to go to 5 separate appointments, you can just have one appointment, but it's also really important for your care overall because it allows us all to collaborate and come up with the best treatment plan for you. So just a couple things about what to expect at your urology visit, and these may be things that you've already experienced, but just so that you kind of understand why we're thinking these things when we ask you questions, we'll talk to you about things like, how do you empty your bladder? Are you peeing on your own? Do you catheterize? How often are you peeing or catheterizing? We'll want to know about any recent urinary tract infections. So if you've had a new urinary tract infection since your last visit with us, we'll want to know about that information because that's really important in terms of deciding if we need to do additional testing. And of course, if you have any of your urine culture results that you can bring with us, that's an extra bonus if you can. We also will ask you about any new or worsening urinary leakage, or if you've had any new or worsening abdominal pain. And like I said earlier, we'll want to know about your bowel movements. So we're going to ask how you're emptying your bowels, if you're taking any medications, doing any enemas, and so forth. We'll also go over any medications that you're taking. And as we'll talk about a little later, there are certain medications you may be on for your bladder, such as ditropan, and we'll want to know how you're tolerating that, make sure you're not having any side effects related to it, and make sure that it's working for you. Also, during your visit, you may get a physical exam. And from the urology physical exam, we're looking to check the kidneys, check your bladder. For males, we're checking the testicles to make sure they're down where they're supposed to be and that they don't have any new lumps or bumps. We also are checking your skin to make sure that you're not having any skin breakdown due to urine leakage. So as you may already know, not only will we discuss all those things, but there might be some tests that you have for your urology visit. The most common test that spina bifida patients will get for their urology visit is an ultrasound. And I'm sure many of you have had several ultrasounds, but ultrasound is really, really important. So with the ultrasounds, we look at your kidneys and your bladder. We're checking to make sure that there's no new swelling on your kidneys and to make sure that your kidneys are growing in size as you grow and make sure that there's no stones or scarring. We're also checking your bladder to make sure that there's no new bladder stones or no new lesions in the bladder or debris that we see. And all these things help us to make a treatment plan to keep you nice and healthy.
Dr. Rafis,
Yes,
I have 2 questions.
go for it.
So the first one, when you talk about the ultrasounds, how often should someone living with spina bifida have an ultrasound done?
That is a great question. We'll get into that in a couple of slides, but it depends on the age of the patient. So for babies, they will have ultrasounds about every 3 months. And then for kids under the age of 5 to 10, they may have ultrasounds every 6 months. And then for the older patients after 10 years old and on, as long as everything's been going okay, the ultrasound will be about once a year.
Awesome. And then the other question was, do you need a referral to attend clinic?
That's a great question. As far as I am aware, you do not need a referral to attend clinic. And Julie, I don't know if you know any additional information about that.
I think my understanding is that when you call to request or schedule an appointment, they've been working hard to schedule them on clinic days,
Yes.
at least for the pediatric visits that I witnessed. I'm not sure how that will work for the adult group.
Yeah, so when you call, so the phone number that we had on the screen, and again, I'll put it at the end. When you call that phone number, they may answer and say that this is the developmental pediatrics department. And that's just kind of an umbrella term for lots of individual clinics that are seen in that department. So you want to ask for an appointment specifically for the spina bifida clinic, and then they will direct you, they will get you scheduled. It's a great question about referrals, and I can get more information for you. But as far as I know, you do not need a specific referral from your doctor. If you're a patient with spina bifida, that qualifies you to come to the clinic.
Thank you.
No problem. All right. So in addition to ultrasounds, you may have to have urodynamic testing. So urodynamics is a test where it allows us to study the pressures in your bladder. And the reason why that's really important is because high pressures in your bladder can be really dangerous for your kidneys. But it's a silent process. You usually don't feel those high pressures in your bladder, which is why we need to do frequent tests to make sure that we're not missing them. So urodynamics is a test where you come specifically to the urology office. A catheter will be placed into the bladder, so either through the urethra where you pee from or through where you're catheterizing. There will also be a tiny catheter that's placed into the rectum. And these 2 catheters help us to measure the pressures in your bladder. And so you'll see this diagram over here. It kind of looks, sometimes I describe it as an EKG of the bladder, but essentially it tells us about the pressures as we fill your bladder. We want to see nice flat lines that indicates nice safe pressures. And if pressures are safe, that means that you're keeping your kidneys safe. If the lines are going up like a mountain, or they're really squiggly up and down, then we may need to talk about medications, catheterizations, and sometimes even surgery. But that's the really useful information that we're getting from these tests. So the test takes a little bit of time. You should, when you have that scheduled, if you have one scheduled, you would be here for about an hour in the clinic. But this test gives us lots of good information. And when we do that test, we also get to take special x-rays of your bladder. So when we're filling your bladder, we fill it also with a dye that lights up on x-ray. And what we're looking to see what the bladder looks like. So this middle picture here shows that the bladder, which is this big white circle that you see here, it's nice and smooth on the edges. And that's exactly what we want to see. Whereas you can see here on the right, this does not look nice and smooth. This almost looks like a Christmas tree shape. And so that is something that we don't want to see. And this patient with a Christmas tree appearance to the bladder is going to need some further treatments because this indicates that the pressures are high and we need to do something to protect the kidneys and the bladder. So all of this really useful information comes from your urodynamics visit. And we'll talk in a little bit about how often you need urodynamics. The babies need it more often than older patients. And for older patients who have been doing well, usually we only order urodynamics if there's been a change either in your symptoms. So if you're having new leakage of urine, or if you start to have urinary tract infections when you never had them before, Or if your ultrasound shows that there's some swelling or some new scarring, or your kidneys have gotten smaller in size when they should be staying the same or getting bigger. So that's why the ultrasounds are super important, because it tells us sometimes if we need to do this further testing. And then lastly, you might have some blood work done for your urology visit. This blood work includes 2 tests that we are looking at to study the kidney function. And you may hear these words creatinine or cystatin C. And those are currently the 2 blood tests that we have available that help us monitor the function of your kidneys. So between the ultrasounds, the urodynamics, and the blood work, this is how we're checking on your kidney function to make sure that your kidneys are nice and safe and keeping you healthy. So just to go over briefly what some of the testing is that you might expect just based on age. So for the babies, before even leaving the hospital, most families should be learning how to do bladder catheterizations. And this is something that we're working on reinstituting. So if you haven't experienced this, not to worry. But the idea is that before patients leave the hospital, they're supposed to be getting catheterized a couple of times to see and make sure they're emptying their bladder okay on their own. And we always like to have families know how to do this in case they need to do it in the future. Also, while babies are in the hospital, they will have some blood work done, and that's part of that blood work. We'll check on their kidney function. Then after babies go home, for the first year, we want to see them in clinic from the urology standpoint about every 3 months. And with each of those visits, we'll get a kidney ultrasound, again, about every 3 months. And sometimes it's not perfect. It goes a little bit longer, a little bit shorter, but because babies are growing so quickly, we like to keep a very close eye on things. Also, during the first year of life, we do get a baseline urodynamics test. So that test where we put the catheter in the bladder and the catheter in the bowels or in the rectum to measure the pressures. That test will need to be done so that we have a baseline and that we can make sure that the baby's bladder is safe in keeping their kidneys safe. Then for kids who are between 1 and 5 years old, roughly speaking, they will have a clinic visit with urology if they're in spina bifida or separate to look at their kidneys, so look at a kidney ultrasound every 6 months with the clinic visit. Kids should ideally have their blood work tested once per year, and sometimes the other doctors that you're seeing also have some blood work they want to check, so we do everything all at once. And then urodynamics are also needed. So there's one set of guidelines that recommend that kids have urodynamic testing every year up until about 5 years old. And the reason why they recommend that is because the bladder is changing a lot as kids are growing so much during those first 5 years. It's also through that time that we'll be able to help figure out if kids may be able to potty train or if they're going to need catheterizations and medications, which we'll talk a little bit more about in a minute. And then for older kids, again, this is generally speaking, but for older kids who are otherwise doing well, clinic visits may be spaced out from every 6 months to every 12 months, and you'll get an ultrasound with those visits. Again, ideally, we would be checking yearly blood work, and then urodynamic testing just if needed. So when we were talking earlier about urodynamics, the reasons why older kids may need it is if there's a change in symptoms like new leakage of urine or new urinary tract infections, or if something shows up on the ultrasound like new swelling, new scarring, then we'll order the urodynamics. So why are all these tests and clinic visits so important? We just went over, you're going to be seeing us a lot. And the reason is because we know that patients with spina bifida are at a much higher risk for developing chronic kidney disease. And so because we know that, that's why we want to do all this testing early on to prevent anything from happening that could contribute to developing chronic kidney disease. Some causes of chronic kidney disease can include infections and the high bladder pressures. So that's why we're always asking about infections, because we want to avoid infections. And that's why we're doing lots of tests to tell us if there's signs of high bladder pressures that need to be treated. Those are just two of some of the examples. And so this is why at each visit with each test, we are monitoring your kidney function to keep you healthy. So let's talk a little bit about bladder management. So what exactly do we mean when we say, what is your bladder management? So most patients with spina bifida will need to empty their bladder by catheterizing. And so when we talk about catheterizing, there's different types of catheters. There's catheters that are placed when you're in the hospital that stay in place with a balloon. But then there's the catheters that you pass intermittently throughout the day to empty your bladder, just like when you would go to the bathroom to avoid. This is called clean intermittent catheterization. And the reason why we call it clean intermittent catheterization is because you can wash and reuse the catheters that you're using to catheterize. So this is just one example here of a straight catheter that's used to drain the bladder intermittently throughout the day. Now, patients who are on clean intermittent catheterization may be catheterizing, depending on how their bladder works, they may have to catheterize every 3 to 4 hours. Some may be able to go a little bit longer, but it's really important to stay on that schedule because catheterizing allows your bladder to empty, and an empty bladder is a happy bladder. Some patients will also need to be on some medication to help either with leakage of urine or high bladder pressures. So you may be familiar with the medication ditropan. So ditropan is, it's also called oxybutynin. That's a medication that works to relax the bladder. So it can help with leakage of urine. If the leakage of urine is due to the bladder squeezing a lot, what happens with the ditropan is it helps the bladder to relax. But then you need to catheterize to empty the bladder because now the bladder muscle is so relaxed it can't squeeze to empty the bladder. The bladder, also because ditropan helps to relax the bladder, it can help with those bladders that have those very high pressures. And so that's another reason why we prescribe it. Ditropan right now comes as a liquid, and then it also comes as a tablet for older kids, and then it also comes as a gel. So there's lots of different ways that it can be prescribed, but it does have side effects, and sometimes those side effects prevent us from being able to use it. So some side effects that you may experience or you may hear about are dry eyes, dry mouth, and constipation. Can also get flushing as well, especially in the hot summer months. So if you're experiencing any of those symptoms or worsening of any of those symptoms while on the medicine, it's really important to talk to your urologist about that so that we can figure out a different option for you. So just to quickly talk about the catheters. So I talked about doing clean intermittent catheterization and reusing the catheters. But this question comes up a lot about whether it's better to use single-use catheters or to wash and reuse the catheters. And so right now, there was this study that was just published last year that tried to figure out if one was associated with more urinary tract infections than the other. And the take-home message is that washing and reusing the catheters is safe and is not associated with a higher risk of urinary tract infections. So when you wash and reuse the catheters, you simply just rinse it with soapy water, and then you can store it in a container, in a dry container, or a plastic bag, depending on what you have available. And those catheters can be reused sometimes for up to 2 to 4 weeks, depending on how clean they are. There are some catheters that people are using as single use, but that's a lot of catheters that you're going through. That's a lot of money, and that's a lot of waste. So that's why we prefer to start with using or recommending that you use reusable catheters by doing the clean intermittent catheterizing by washing the catheters. And then yes, go right ahead.
A few questions about medications.
Yes.
Someone asked, we use Detrol. Is that also recommended?
Yes, Detrol is another medication that you can use. Yes, that can be recommended.
Wonderful. And my next question is, have there been studies that show that it is safer or as effective to give the bladder meds injected in the bladder versus taking them orally? Many of the bladder medications can cause memory difficulties or other side effects.
Yes, that's a good question. So in terms of medication injected into the bladder, that Botox is what we can inject into the bladder to help the bladder relax. So that's a medication that actually gets injected in. So just how we use Botox to help prevent wrinkles because it helps to relax the muscle in the skin, it helps to relax the bladder muscle. So for patients who can't tolerate medications, they may be a candidate for Botox to their bladder. What Botox to the bladder involves is it is a procedure done in the operating room. And You have to go to sleep with anesthesia, typically speaking, but the procedure is very quick, maybe under 30 minutes, and we inject Botox. The problem with Botox, or the one downside, is that it doesn't last forever. So patients will have to go back for repeat treatments every 6 to 12 months. And for every patient, it's different. Some patients, it works really well for more than 12 months, and some patients barely get to 6 months with it working. In terms of other medications used inside the bladder, there has been talk about, or some people have used the ditropan or the oxybutynin dissolved and instilled into the bladder. So it's not injected, but it's instilled through a catheter, and then your bladder holds onto it. I personally don't have a lot of experience with using that or its efficacy. It depends on how long you're going to be able to hold it in the bladder. And the way that the oxybutynin works is it depends on the formulation that you're using in terms of how long the effect will be. But that is another option that if you are having trouble tolerating the medication, that we can explore for you.
Thank you. And do you have any suggestions? Is any medication better, ditropan versus Detrol versus Myrbetriq?
Myrbetriq, yeah.
Myrbetriq, yeah, thank you.
Yes. So it's a really good question. So typically our first line treatment is to start with the oxybutynin. Now it depends on the age of the patient. I should start with that. So the only one that comes as a liquid is the oxybutynin. So that's usually why most patients get started on oxybutynin first, because it's a liquid formulation. And so younger kids who can't yet swallow pills are able to take that. So typically oxybutynin is the first line medication, but Detrol works in a similar way. It may not have as many memory or cognitive side effects. And then Myrbetriq, the overall effect is the same, but it works in a different mechanism. In my experience, sometimes insurance companies will give us pushback on covering some of those medications because those are second or third line medications. So sometimes it depends on the insurance companies and what they will, sometimes you have to try one before they'll let you go on to try the other one. But those are all things that we will work with you and help to make sure that you get on the right medication for you. So I don't want you to think that ditropan is the only, or that ditropan or oxybutynin is the only medication, because it definitely isn't. It's just the one most popularly prescribed, but nowadays we have lots of great options for medications.
Last question, I think.
Yeah.
And I may need you to say that word for me again. Does Myrbetriq cause memory side effects?
Myrbetriq should not cause a significant of memory side effects because it works in a completely different way than the other anticholinergics. So that's a good question. All right.
Great. I think that is it for now. I have a few more, but I will save some of those for the end, and I will let you know if we have more come up.
Okay, great. Okay, so just to finish talking about catheterizations and urinary tract infections. So we kind of touched on that in the last slide where we were talking about if it's better to reuse the catheters or to use a brand new one every time. And we know that reusing them does not increase your risk of urinary tract infections based on current studies that have been performed. But urinary tract infections, we talked also about, it's important that we know about them. But the hard thing can be that patients who catheterize are always going to have bacteria present in their urine. And that's okay. This is what's called asymptomatic bacteria. And asymptomatic bacteria does not require antibiotics. So if you're having symptoms, though, of a urinary tract infection, then we should check you for an infection. So those symptoms may be a fever, if you're seeing blood in the urine, if you're having abdominal or back pain or discomfort, if you're having new urinary symptoms like new leakage or new urgency, feeling like you need to cath more often, or if it's really painful to catheterize when that's never happened before, those may be indications that you're having a urinary tract infection, and that would be a reason to get a urine culture done to check for a UTI. If a doctor were to just check your urine when you're not having symptoms, that will always be positive, but that should not be treated. Only should be treated if you have symptoms. And the reason why that's so important is because as you've probably heard, the bacteria can get resistant to antibiotics. And so if you get lots and lots of antibiotics that you may not necessarily need, then you can develop resistance to bugs. And then what happens is if you're resistant to those certain bacteria, if you get a real infection with symptoms, you may have to be admitted to the hospital for IV antibiotics because it's resistant to all of our oral options. So just a really important point. Definitely if you're having the symptoms, we want to know about that and we should check a urine culture. So what to do if you think you have a UTI, if you have any of those symptoms, if you have the fever, pain with coughing, abdominal pain, even a foul odor to the urine, but the foul odor to the urine, sometimes if that's the only symptoms, sometimes just drinking a little bit more fluid may make that go away. It may just be that it was a little bit concentrated because you hadn't had a lot to drink. So we have to put the whole picture together. But if everything lines up and it sounds like a UTI, talk with your doctor. You can either talk with your primary care doctor or pediatrician or with your urologist, and make sure that you get a catheterized urine culture. And then the culture takes up to 48 hours for the final results to come back. So the final results tell us if there's bacteria there, what type of bacteria, and then what antibiotics we can use to treat the bacteria. It's really important that if you do get antibiotics, that you finish all of the antibiotics that you're given, because if you don't complete the whole course, that can also result in the bacteria becoming resistant, and we really don't want that to happen. And then finally, make sure that when you see your urologist that you let them know if you had an infection. So just to briefly talk a little bit about some surgeries that we do in the urology department for patients with spina bifida. So when would we maybe start to talk to you about surgery? So if you are having recurrent fevers related to infections, you may need to have surgery. If we find that there's really high pressures in the bladder that are dangerous and unsafe for the kidneys, even though you've been on medicines and catheterizing, then we may recommend surgery. If you need an easier way to catheterize, if it's really hard to catheterize per the urethra, we can build channels, what we'll talk about in a little bit, to make it easier to catheterize. You may also need surgery to help with leakage of urine, so to help you be dry of urine or of stool, which again, we'll talk about in a minute. So this is just a very brief overview of certain surgeries that you may have heard about for patients with spina bifida. And we're just gonna talk about them briefly today, but I'm happy to talk about any of these options more in depth. I just want you to know what's available and what options we have to help improve quality of life and to keep your bladder and kidneys safe. So the Mitrofanoff, or the appendicovesicostomy, is a catheterizable stoma that's on the abdominal wall. So if you look at this picture here, this is showing the belly button, and this is where the stoma is. And what we typically do for a Mitrofanoff, this is a surgery done to help kids catheterize or patients catheterize. And you catheterize through your belly button or the belly wall so that you don't have to go through the urethra, which can be hard to access. It would require you to transfer, maybe out of a wheelchair, which can be really hard to do if you're out in public. So this gives you an option on the belly wall to catheterize. We usually use the appendix to create that channel that then goes into your bladder. And so instead of catheterizing from below down through the urethra, you simply pass the catheter intermittently throughout the day on your schedule through the belly button into the bladder to drain the urine. And then when it's done, you take the catheter out. And this should not leak urine. And it's usually, we try to hide it in the belly button so that no one would ever know that you even had that there. So you may have heard about bladder augment. So some patients may need us to create a bigger bladder for them because their bladder is not growing with them and it's resulting in very high pressures. So you may have heard about bladder augment, which is where we use a piece of bowel to help build you a bigger bladder. And sometimes the bladder augment and Mitrofanoff surgeries are done at the same time. And then lastly, you may have heard about bladder neck procedures. So some patients may have leakage of urine from their urethra, and that can be due to a weak sphincter. So the sphincter should help to squeeze to prevent the urine from leaking when we don't want it to. But sometimes patients with spina bifida, that sphincter is weaker and it can't shut completely to prevent the urine from leaking out when we don't want it to. So there are procedures that we can do to help strengthen and tighten that sphincter area so that you don't leak urine from there. If we do that procedure though, we do need to give you a way to catheterize. So we typically do that when we do the with a Mitrofanoff, to give you a way to catheterize the bladder so that you can safely empty the bladder, and sometimes an augment. So you could have one of these procedures or all three of these procedures. And again, there's a lot more to talk about here, but I just wanted you to know what's available, and we can talk in depth further later on. Lastly, I just want to make sure that we talk about pooping. So as a urologist, I think I talk about poop more than I talk about urine, which is really silly to me, but pooping is super important for healthy bladder and kidneys. And so most patients with spina bifida are constipated. And the reason why this can be a bad thing is because constipation can cause urinary tract infections. It can cause urine leakage or stool leakage. And so most patients are going to need help emptying their bowels regularly. And so you may be asked to look at this chart once in a while to tell us what your poop looks like when you are pooping. And this chart helps us to understand if you're constipated, which is if you're passing these really small hard lumps that either look like rabbit pellets, or here they describe it as looking like nuts. It's really hard to get the stool to pass. Or if it looks like a sausage or a snake that's smooth and soft and passes really easy. Or is it really, really watery? We want to know all these sorts of things because it will help us treat your bowels better. So what are some ways that we manage the bowels? And again, I'm just going to briefly mention some of the options. And again, I'm happy at any point in time in the future to go over these more in depth. But if for kids who are constipated, the first step is to start with medications to treat the constipation, because ideally we want you to empty your bowels once a day in an ideal world. So babies may be getting glycerin suppositories to help them poop. Younger kids may get Miralax, which can be mixed with water, juice, Gatorade, or Powerade. Or there's medications, tablets called Senna or Colis. And these medications work to help the bowels, the stool, hold on to fluid or to water so that it makes it more easy to pass the stool through. The benefits of the medicines is it's easy to give. You just drink a liquid or take a medication, but it can result in an unpredictable timing of bowel movements. So for some patients, this can make it really hard for them to achieve continence of stool because the Miralax, you may take it in the morning, but it may not kick in until in the afternoon when you may be out and about and not at home. And every patient has a different experience, so we have to figure out what works best for you. There are other options though, besides medications, that I think are really good options. And these are enemas, and you may have heard about these. So this picture here on the right, this is a picture of a cone enema. And so essentially what an enema is a solution of either water or saline, and we add soap to it. So different types of soap you may hear about are glycerin or Castile soap. And what this does is you mix this mixture in the bag, and then it runs through the tubing. This cone goes into the rectum. You hold it in place, the fluid runs through, it runs into the rectum, up into the bowels. You let it run in for about 10 minutes, and then you remove the cone, and then you sit on the toilet for anywhere from 30 minutes to 60 minutes. We don't want you to go over 60 minutes, typically speaking. But the whole idea with this is with the water and saline, it helps to soften the stool, and then with the soap, it helps to push everything through the colon. And the idea is that you just have to sit on the toilet to have a bowel movement once a day. And because it does such a good job of emptying your bowels, then you're clean of stool in between the enemas. So you should be continent of stool in between your enemas. This has been really life-changing for a lot of patients that I've worked with. And there's different enemas. So the picture that we just looked at was the cone enema, but there's also a Foley enema, which is here. So using a very large catheter with a big balloon that gets blown up, and the enema solution gets pushed through the catheter. Or Paracene enemas, which is a nice, easy to use system, but sometimes insurance doesn't always cover it. And then there's also antegrade enemas. So this is kind of similar to the Mitrofanoff or the appendicovesicostomy, where you catheterize through your belly button. This is where you have an area on your belly wall where you can administer the enemas. So this picture down here, this is a picture of a vesicostomy tube. And so the idea with the vesicostomy tube is it's a tube that's placed through the belly wall. into the bowel, and it curls there and it stays there. And through this button here, you can inject the enema solution, and then it will flush out the whole colon all the way out, so that then you're passing the stool. And again, you sit on the toilet for anywhere from 30 minutes to an hour, depending on your regimen, and empty the bowels once a day. If you didn't want to have a button but wanted to have a way to do this through the belly wall, we can also do a surgery where we can also use the appendix to make a little channel, and you'd have a little tiny stoma. It would not drain stool. You would not need a bag over it, but it would be a little stoma where you could pass a catheter into it to then administer the enemas. So all of these are just, again, there's a lot to talk about, and I just wanted to make sure that we just touched on all the different things that we can offer to you to keep your kidneys safe, to improve your quality of life through medications, catheterizations, or through surgery if you're interested or if you need that. And I just want to put a plug in that obviously these are unprecedented times right now, and with COVID, things had to slow down a lot, but it is safe to come in for your doctor's visits, and it's really important to make sure that you're coming in for your regular visits so that we can make sure that you're staying healthy and that we can talk about any concerns that you have. So with that, thank you so much for the opportunity to talk with you all tonight. I'm open for any other questions that come through. So Julia, let me know what we have.
We have a good chunk right now. So
okay.
I think I'm going to start with one focus area, which is UTIs.
Okay.
So the first question I got was, what are the best practices for urinary tract infection control? So
I think, and whoever asked the question, if I'm not answering it the way that you intended, just let Julia know. But so the most important thing with UTI control is to prevent infections from happening. So that's by making sure that we have a good way to empty your bowels regularly so that that's not contributing to infections. That's where making sure that we're emptying your bladder on a regular schedule so that your bladder is not getting too full and sitting too full for too long of a period of time. And then understanding if the infections are just in the bladder or if they're affecting the kidneys. So if you're having high fevers with the infections, that may be something where we go down a different pathway, because that may be related to other things such as reflux, which we can see in the little kids. And with the fevers, we really want to protect those kidneys. When it's bladder infections, so if you're getting recurrent symptomatic bladder infections, and so this is where it always gets really tricky because we would need to make sure that they're symptomatic infections. But sometimes patients have to be on a low dose of antibiotic for a period of time. Sometimes patients will have to do what are called bladder irrigations. And so for patients that are catheterizing, often they may have some sediment that builds up in the bladder. And so you can do irrigations with even just regular saline, or sometimes with antibiotics that can get instilled through the catheter that you flush into the catheter or into the bladder and let it sit there until the next time that you catheterize, and then you empty. So there's lots of different ways that we can treat infections, but most importantly, we want to work on preventing them by making sure that you're emptying your bowel and your bladders effectively.
Awesome, thank you. So another question was, it used to be a general rule of thumb that if you cultured over 100,000, that you would have a positive UTI, greater or lesser than. Is that still the truth?
So we do look at the number of colonies that you culture, but it's most important. So for patients who are catheterizing, if you're having symptoms and the greater than 100,000, then yes, that is what we would call a urinary tract infection. If we just randomly tested your urine and that showed up on the urine culture, we would not necessarily call that a urinary tract infection if it was just a random screening test.
Awesome. And is it important to keep track of what you culture out in your UTI?
Yeah, so I like to keep track of what bacteria people have grown, and then also what antibiotics they are resistant to or sensitive to. So with the bacteria, there are certain bacteria that are more commonly found in the urinary tract to cause urinary tract infections. And then there are certain bacteria that may become super resistant in the future. And so I keep track of what bacteria you've grown, and that's why I like to know about all the infections you've had, because it helps me understand, one, to make sure that there's not anything unusual growing that we should investigate further, or to make sure that you're not developing lots of resistances that would then maybe mean if you got a really bad infection, you need to have IV antibiotics for it and have to be admitted to the hospital.
Wonderful, thank you. I do have a few more questions, but I just want to remind you all that, if questions come up, please use that chat function as we keep going. My next question is about neurogenic bladder and the impact of drinking water versus drinking soda or alcohol or coffee, and how that, affects a neurogenic bladder and what that is.
Okay, that's a tough question. So it all affects basically how much urine you're making. So it kind of goes back to the kidney, which is the kidneys are responsible for filtering your blood. And so anything that you have ingested during the day that gets into your bloodstream, the kidneys will be responsible for filtering. So water is always the best thing to drink, but you can drink dangerous amounts of water. So I always tell patients, we want you to drink a lot. Water is great, but you can drink other things as well. The more that you drink, the more urine you will make. So the more often you may have to catheterize, depending on your bladder function. With things like alcohol will make your kidneys, it acts as a diuretic. So a diuretic means that your kidneys are going to make more urine. So by drinking alcohol, you're going to make more urine just naturally. That's the way it affects the kidneys. And so for patients who have had bladder surgery, like a bladder augment, drinking alcohol can be almost dangerous, because what can happen is you make so much urine that the bladder gets overfilled and can put stress on the suture lines that you have, even if you had your surgery a really long time ago. And so it's really important that you're catheterizing regularly to make sure your bladder is not getting overfilled. Things like coffee or tea, so everything in moderation. Because I'm a coffee drinker, I really can't bash anyone for drinking coffee, but everything in moderation. So caffeine also can make you urinate. It can actually make you more dehydrated because it makes your body process the fluid a little bit quicker. But in things like tea can also increase your risk of urinary tract or of kidney stones. So all things that's why I just kind of go back to everything in moderation.
Great. What does someone do if they don't cath but are having leakage, urgency, and strong odor?
And so if they think they might have a UTI. So if these are new symptoms for you, what I would recommend is getting checked for a UTI, but to check for the UTI to get a catheterized specimen. So to pass a catheter into the bladder to obtain that specimen, because that's the most clean, sterile way to get the specimen, to make sure that we know 100% if there's bacteria in the bladder or not.
Great. My next question.
These are good questions.
Yeah. How often should the VCUG test be completed? And I'm not sure if you did touch on that, but it did come back up.
Okay, yeah, we talked a little bit about that when we talked about the urodynamic test. So we will do the VCUG as part of the urodynamics, definitely on the first one, and then maybe on follow-up ones, because the VCUG test tells us a lot of different things. So one, it tells us if the bladder is nice and smooth, like we saw that picture where it kind of looked like a nice smooth balloon, versus if it looks like a Christmas tree, because those can be signs that the bladder is not healthy anymore when it looks more like the Christmas tree. But it can also tell us, we didn't talk about this, but it can also tell us about reflux of urine. So some patients may have urine that goes from the bladder back up to the kidneys. And that could be either the way that the urinary tract forms during development, or it could also be because of really high pressures in the bladder. And so the VCUG test, we typically will perform at the time of urodynamics if we have one to check on the way that all of those things look. If there's any history of the reflux, then you will be more likely to get the BCUG test at your follow-up urodynamics. Sometimes we'll do the BCUG test separate from the urodynamics if we're just looking to check out if you're getting a lot of febrile urinary tract infections, and if we just want to see about the reflux aspect and we don't need to do the urodynamics. So that's all the different information we can get from that test.
Wonderful. My next question, do you perform the artificial urinary sphincter surgery? I had mine at age 12 and replaced it at 45. Can you speak to this?
Awesome. So that sounds like you got a lot of years out of it. Yes, I do perform that. And for older patients, we also have some of our adult colleagues that we work with who also perform the surgery. But yes, that is part of what we do as part of the surgery. So I hope yours is still working, but if not, I'm happy to help figure things out.
And do you mind just touching on what that surgery is?
Yeah, for the sphincter.
Mm-hmm. Yeah.
So for patients, so back to when we were talking about surgery for the bladder outlet. So for patients who are leaking urine because the sphincter, the muscle is not tightening up tight enough to let us hold on to our urine when we want to hold on to it. Some patients we can do different things. So there can be a sling, which elevates everything and really helps to tighten down that area, or the sphincter. So the sphincter is this artificial device that we put in, and it basically acts as a cuff around the urethra where you pee from. And there's a little bulb where you can inflate the cuff. And when it inflates, it keeps everything nice and tight so you shouldn't leak any urine. And then when you want to empty the bladder, you simply press the cuff and the urine and then you'll be able to release the urine either by peeing or by catheterizing. The cuff, the part that you press to do all of this, for men, it's typically in the scrotum. And then for women or girls, it will be in the labia. Because it's an artificial, it's kind of not made of plastic, it's more of silicone, but the risk of the procedure, the biggest thing we worry about is it getting infected. So, those are the things that we watch for very closely around that surgery, but it's a great option for some patients. For patients, when I recommend it, you will need to have urodynamic testing beforehand to make sure that we understand exactly how your bladder is functioning and what is the best option for you.
Awesome. Thank you.
Yeah.
And I had one more question that was submitted. Is it possible for someone with spina bifida who has never had bladder issues to start having them as an adult?
Yeah, so anything is possible. And so I think it's definitely important to, if you're starting to have new bladder symptoms, to get set up with urology to investigate, start with an ultrasound and maybe something that requires urodynamic testing to understand what the cause of those new symptoms are. So it could be any number of things. It could be related to constipation. It could be related to the bladder changes. It could be related to things in the spine. So it's important to touch base with your doctors so that we can help to figure out what's going on, because you shouldn't have to live with that. We can figure that out.
All right, that was all I had for questions.
Okay.
I'll give you guys, if you guys have any other questions, just throw it in a private chat to me now. But otherwise, I think we can start wrapping up.
Okay, well, thank you again so much. This was really fun, and I'm looking forward to meeting everybody in clinic. And then you'll give them all this information so that they have all the phone numbers, and my email is here as well. So if anyone has specific questions and wants to reach out, I'm happy. I usually will get back to you within 24 hours.
I had one more question come in. If bladder pressures change as an adult, does this mean tethered cord?
So that's a good question. So tethered cord may have a change in bladder pressures. We'll also see, so when we talked about the urodynamics, we want to see nice flat lines, and sometimes there's a mountain. But then also when there's tethered cord, you may have what's called overactivity. So you'll start to see a squiggle in the lines. And so symptoms that you may have are feeling the need to cath or pee very frequently, feeling some abdominal pressure maybe, but that sensation that you need to empty your bladder more frequently than you did before. And then when we do urodynamics, we may see that overactivity, which can be a new finding in addition to elevated pressures. So those things can indicate tethered cord.
Awesome. Well, thank you.
I know.
So I guess we can wrap it up and